8 Ds to manage heart failure. Heart failure, also known as congestive heart failure and congestive cardiac failure, is when the heart is unable to pump sufficiently to maintain blood flow to meet the body's needs. D1. Digoxin. Digoxin is a cardiac glycoside that increases the force of contraction of the muscle of the heart and thereby pushing blood from inside the heart into aorta and pulmonary arteries. Digoxin can reduce the heart rate, therefore, it is contraindicated when the patient's heart rate is less than 60 beats per minute. D2. Dopamine. Dopamine is a precursor to norepinephrine in noradrenergic nerves and is also a neurotransmitter in certain areas of the central nervous system. Dopamine produces positive chronotropic and inotropic effects on the myocardium, resulting in increased heart rate and cardiac contractility. It also increases renal blood flow. Dobutamine. Dobutamine directly stimulates beta 1 receptors of the heart to increase myocardial contractility and stroke volume, resulting in increased cardiac output. D4. Dilators. Vasodilators help widen or dilate blood vessels. This reduces blood pressure and makes it easier for the heart to pump blood. When you have heart failure, your heart does not pump well. So, opening narrowed blood vessels is important. This reduces how hard your heart beats to work. It may help keep blood from backing up in your heart and lungs. Example, nitroglycerin. D5. Drugs for blood pressure. Drugs for BP such as beta blockers, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, aldosterone receptor blockers, hydralazine, and nitrates, which have shown mortality benefits in CHF and exert antihypertensive effects, should be used as first line agents to control hypertension in CHF. In addition, antihypertensive drugs such as alpha receptor blockers that can increase mortality in HF should be avoided. D6. Diuretics. Diuretics help your body get rid of extra water. They are also called water pills. Taking these medications can reduce your symptoms of heart failure and help you feel better. Taking these medicines on a regular schedule will help you control fluid buildup in your body. This can reduce the chance that you will need to go to the hospital. Example, furosemide. D7. Diet. Foods high in saturated fat are a major driver of high blood cholesterol levels, and too much salt in your diet can contribute to high blood pressure. Both of the conditions increase your risk of developing cardiovascular disease and cardiac failure. D8. Device therapy. Device therapy plays an important role in the treatment of heart failure patients. For instance, the implantable cardioverter defibrillator improves survival in patients with ischemic and dilated cardiomyopathy and low ejection fraction by reducing the rate of sudden cardiac death. Cardiac resynchronization therapy reduces symptoms and hospitalization due to heart failure. It improves ejection fraction and also enhances survival in a subset of patients with heart failure. 8 Ds of heart failure: digoxin, dopamine, dobutamine, dilators, drugs for BP, diuretics, diet, and device therapy. Please subscribe, like, comment, and share. Thank you.